Right, magazine under the arm, AirPods in. It's time for a quick dump.
So, I want to touch on toilet anxiety because this is one that I have so many, or we have so many family and friends that suffer with this. You know, maybe needing to know where the toilets are, or they find the commute really difficult. And then it was amplified even further when we realised how many people, came into PHQ on the clinic, how many people suffered with this. And like, it's not until you speak about it until it sort of opens up the can of worms, and you're like, wow, there's probably 4 or 5 people in my close circle
Yeah.
of people that suffer with it. So what is toilet anxiety? How many people suffer with it, and what tips have you got for people that do suffer with it?
So I reckon there's two different types of toilet anxiety. There's the one you're describing, Alana, where people probably have a gut health problem or have experienced something like incontinence in the past, or what I would call urgency, that real urgent need suddenly to rush to the toilet. And that can obviously be really unnerving because obviously if it happens somewhere where there's no toilets, my patients might happen to them when they're walking their dog, for example, in the middle of nowhere, then it's really difficult and people can become more anxious. The other side of that is that people who don't want to use a toilet at school, in public, away from the house, in the office, wherever they might be, and that then can lead to other problems. So the first bit is about fear, essentially, isn't it? It's about probably something bad that's happened in terms of toileting, whether it's that they've not got there in time or they just suddenly get this urgency, or sometimes for some people it's because in the mornings they need, not necessarily in the morning, it could be any time of day, but they have a problem where they're not fully evacuating their bowel. So it might take them 5, 6, 7 attempts to fully evacuate the bowel. That's usually caused by things like a prolapse of the rectum and the anus, or by things like a rectocele, which is a bulge of the bowel into the vaginal cavity, and then things just sit in the wrong place and you can't evacuate them properly.
So is that like feeling you need to go, but it's not coming out?
Exactly that. Yeah. So the stool's normally soft, but they can't get it out. It's not like normal constipation. And it just builds up a fear in people's heads. It becomes a big problem, and people don't want to go on the tube in the morning, or the train, or the bus, or even in the car on the way to work. They're worried about where the nearest toilet is all the time. And it can really rule people's lives and mean that their lives become really quite small and isolated, because if they don't trust where they're going, then it can be a problem. And that equally happens when people have been told can't eat any of these foods because of your symptoms, or it's going to make you worse, or they've done one of the intolerance tests, that kind of thing, because they're not sure which restaurants they can go to and what they can eat safely, in inverted commas, because probably they would be fine with everything. It's life changing and life limiting for people when that starts to build up in their minds. And it's not necessarily just in their minds. Sometimes it is the case that actually there could be an accident if they don't get there in time. But I think working with a dietitian to try and help to manage the symptoms is super important. And also maybe with psychology or meditation, breath work, hypnotherapy, these things that can help us to calm that connection between our gut and our brain. Sometimes it's the case that something has happened once, but never again, but people live in fear of it happening again, and that starts to rule their lives, and that's really problematic for people. The other way around then, where people don't want to use a toilet in public and won't, and ignore all those signals that they're getting to go to the toilet, generally leads to a chronic constipation picture. And that's also, I think, to do with anxiety about smells, anxiety about dirty toilets, anxiety about just not feeling comfortable in the environment that you're in. And I hear that all the time. It's almost always women, because I think women are taught to be clean and not smelly and all these kinds of things. And, going for a poo is viewed as those things, which is difficult. It also happens to children. So if small toddlers get a bit constipated and they have a poo that hurts, they don't want to go to the toilet and they withhold, and that can be difficult. But usually that's just a phase. But obviously for some people that can happen, and then it can continue to be a problem. I was working with a patient who struggles with the coordination of her anus and her rectum, which is quite a complicated bit of kit when we look at it properly. And because it's sometimes very painful to go to the toilet, she's sitting on the toilet and she wants to go, but she's frightened to go because if she does, she's going to have pain. And so it just becomes this bit of a cycle where she's trying to relax on the toilet to open her bowels, but she can't relax because her body and mind's connected pain with going to the toilet, and that takes a while to undo.
And it get quite complex. Like these, it could be trauma from when you were 10.
Yeah.
That something happened then, and then your whole life that builds up, or it's, it's like, it's crazy how stigmatized it is, when actually it needs talked about and opened up in order to find why that might be in, how you can help it.
Well, I think this is the thing. There's always answers. There's always things you can do to help. But people may have at some point reached out for some help and been knocked back or told, "Oh, just get on with it," or whatever it might be. Or they may never have been able to speak about it because they've not found out about the gut stuff and looked at what we do.
This
and
is
all
your
that
safe
stuff.
space.
Exactly. So I think the answer is to get help and seek help. And dietitians can help with some of it, and psychologists are better to help with other bits of it.
And in terms of like tools in our armory, are there any sort of like instant things that you can do in that moment where you're like, oh my God, I'm gonna.
Yeah, absolutely. So breath work is really powerful. A bit like if you're trying to have a baby, but you don't want to push it out immediately. Deep breaths, so either panting breaths or deep breaths can be really helpful. There are certain sort of specific breaths, like lion's breath and things like that, that people would say. Yeah, so things like that can really help. And it is about trying to calm the connection between your gut and your brain and just go, it's okay, brain, we're going to get there. Everything's going to be all right. Sometimes people use gut-directed hypnotherapy, which is really effective. It's in the NICE guidelines now for the management of irritable bowel syndrome. And that's sort of self-coaching through what's going on in your body. So again, it's this kind of, everything's going to be okay. We're going to get there. Don't panic. The more you panic, the more adrenaline there is, the more likely you are to induce also a nervous poo on top of what's going on already. And that's going to make things worse. So we can try and keep calm and work on those techniques. We can then limit the possibility of that happening, but also help us to cope with knowing that we can retain if we need to. If you really can't retain, but you need to, then pelvic physiotherapy is really helpful and important, and that can help to retrain the pelvic floor so that you can retain as long as you need to when you can get to the next bathroom.
And there is a pass now you can get if you do have gut issues, isn't there, from the NHS or a GP, which means you can use any toilet anywhere when you show that pass.
Yeah, absolutely. It's called an I can't wait pass, I think. And if there's a big queue for the toilets, you could discreetly show it to the person at the front of the queue and say, I'm really sorry, but I have a condition, please may I use the bathroom first? And anybody sat in this room, I'm sure, would be absolutely no problem at all and not be funny about it. And you may come across one or two people who are funny about it, but that's them, not you, being horrible.
And I think it's also really reassuring that all of these, this got to go armory is free.
Yeah.
And, it's free, it's accessible. But I think when people don't, you have to sort of approach these things with action, don't you? Because, and I always think like even just to sort of short circuit your brain, if you're doing something else, even if it's just a distraction, it can be a good thing. But a lot of people just don't know that that's, and when you're anxious, like I know when I'm anxious, the last thing I want, you're like, oh my God, I can't even breathe in. I'm like, oh God, no. But if you've taught yourself and practiced that breath work, for example, when you're at home, comfortable, when your toilet's near you, you'll have that big, strong tool in your armory when you're out and about to just pull it out.
Calm it down. Yeah, absolutely. And I think maybe we can think about it a bit like if you desperately need a wee, which happens so much more often than desperately needing a poo, right? Or being urgently needing a poo for most people. And we all know that if you really need a wee, it's really helpful to be distracted from that.
It's like you're the sweating.
Yeah,
you're like,
shout to somebody.
I thought you were going to be a little bitch there because you hate when I need a wee.
Oh, you're so annoying.
Because I like dance around like dee-dee-dee-dee-dee.
Like,
I
I
was
can
like,
it
let's go!
emanates like stress off her. I'm like, oh my God, please just go. Like, do it in your pants, anything. You're stressing me out.
That's really, really unsupportive and nasty.
But I think, we are familiar with that. And from your own experience, and kids do it as well, don't they? Jump around and they get a little bit when they need a wee and they don't want to go. And I think if we can try and do something similar when we need a poo and just be calm about it, but also, okay, this needs to happen, but I'm going to get through it and it's going to be okay. That's the main thing.
And how, I guess like when's the tip over? Because a lot of people will go, I'm going on a hike. It'd be good to know where the toilets are because I'm going on a hike. Versus I'm going to plan with every journey with toilets just in case.
I'm not going to go on holiday to this place. I know lockdown was really big for people because so many places were shut. Like I'm not going to go on this sort of holiday because
or a long car journey. I'm not going to go in the car. I'm going to get on the train because there's a toilet there. Like at what point is I guess it's a big loaded question, but when should you seek help or talk about it?
I think if it's associated with symptoms, then it's time to get help. So if it's that you have diarrhea regularly and you're not really sure why, I think one of the things that's really powerful in working with a dietitian is that we can say, it's likely to be when you eat these things that this is going to happen. And for some people, that level of control is enough for them to go, I'm going to go out and eat a curry tonight. I know it's got loads of onion and garlic in it, for example. I'm going to have a problem tomorrow, but at least I'm in control of it. Whereas before, it was just a complete mystery what was going on and they had no idea what was causing the problem. So if it's associated with symptoms and you notice that you've started to really think about planning everything around toilets, that's the time to get help. And if it's the earlier we can manage these things, the easier it is to manage them in the long run. When I see patients who have had a bowel problem for 6 months, I'm like, great, we can turn this around really quickly. Whereas because the microbiome's still adapting, it's not fully set in yet. Whereas if someone's had the problem for 10 years, it's going to take a lot longer to undo the changes to the microbiome that could be contributing to that problem. So the sooner you get help, the better, and the easier it will be to manage it in the long run.
Well, that's your action. Seek help if you need it.